Hi, everyone. First of all, I would like to thank to the organizers for inviting to this conference to talk about the strategies for diagnosis and treatment of muscle strain and return to play protocol at Football Club Barcelona. It's a great pleasure and a privilege for me to be here on behalf of Football Club Barcelona. And let me introduce myself. I am Dr. Gil Rodas. I am a sports physician medical doctor at Football Club Barcelona. I'm a former team doctor at the first team of both football and basketball. I am currently a deputy of the medical department, and I am in charge of the research and innovation area in the Barça Innovation Hub. I do not have any conflicts of interest to disclose, and everything started in 2004, when Messi made his debut at Camp Nou. We need to remember that the most important part of our world is to take care about the health of our players. You can see what's happened after 20 years to suffer to stay in Football Club Barcelona. No, now I am my hair now is white. No, well, in a football team you can expect 40 injuries of these, 15 muscle and 5 tendon injuries per team and per season. That is important because we know that muscle injury is the most common injury in our world. Not only in men, also in women, maybe a little bit more, a little bit less, between 10 and 15 muscle injuries per season. And with a different localization affected, but this is now is changing, and probably in the next years, we will see that muscle injuries in men and women are the same. And this is not this is a typical situation that is not in just only in one club, if not in all professional football clubs, it's happening the same. Thanks to the preventive strategy, we can reduce the incidence of the many injuries, but in terms of muscle injuries, no. Our opposite is increasing muscle injuries every season. And that's why, well, this maybe we need to have another talk another day, but it's very interesting to thinking about why are increasing muscle injuries in the football clubs today. This is our example, that is the data from the Football Club Barcelona, and as you can see in the blue bars, the muscle incidence injuries during every season, but the mean, as you can see, always is more or less the same, even with a little bit increase. And as you can see in this screen, an example of different injury profiles related to different coaches. And these coaches there is 10 coaches in over 20 years. Do you know the importance of these coaches in managing injuries? It is really, really high, no? Well, and as you can see in the slide from the UEFA Medical Committee, the prediction for the future doesn't look good. Opposite, no? We can expect that maybe double hamstring injuries in 2032. Well, when the player is injured, the only question is when he be able to compete again. This is the first question that the coach asks to the medical doctors, no? Where he will be able to compete again, even in the field, just suffer the injury. But sometimes even they would like to know the diagnosis and the prognosis in 1 minute. And sometimes even the prognosis, the coach say, he must be ready to play in 2 weeks, no? Because maybe there is an important match. We believe that that the best way in order to manage muscle injuries, we believe that the good diagnosis is the key to have the good initial management. Of course, and we need to know the injury mechanism, we need to know the risk factors of every player, we need to do the physical examination, we need to do the physical test in order to know if they lose the strength, some things like this. And of course, the imaging exploration is also very important to do. As you know, ultrasound is a stethoscope for sports physician, but is really that when you need to be very accurate in the diagnosis of muscle injuries, you need an MRI. ¿Vale? today, when we talk about calf injuries, for example, ultrasounds can help us. But if you have a soleus muscle injuries, you always need MRI. In terms that to know exactly the localization of the injury, you sometimes need the MRI because ultrasound is not enough. And well, another thing that is important to remember, you need to have a good machine, but of course you need a good radiologist in order to working together to reach a consensus for both diagnosis and prognosis. This is a muscle, a soleus muscle. And that is important because today we know that when we are talking about muscle injuries, we need to take into account how many connective tissue are affected. You may have a large area of muscle injury affected in this area, in the muscle, with you affected different kind of muscle fibers, but the prognosis is better than if the aponeurosis or tendon is affected. Repeat, you can have a large muscle injury in this area and a little or small injury in this aponeurosis. This injury has a worse prognosis. For this reason, you need to be a very accurate imaging diagnosis. Probably you know, because the literature, we have published many papers about this concept, that based on the amount of extracellular matrix connective tissues affected, and how is it important to have the good diagnosis and the prognosis. You can see in this image of the MRI how this central tendon is affected for an injury. And maybe you don't see an important feeder, but there is an important gap in this intramuscular tendon. And that is show you that this has a bad prognosis. Currently, there is a big challenge in sports medicine. This how to manage the proximal hamstring complex injury, specifically when it's affected the free tendon or the central tendon. Today, in the world in the football world, every sports medicine, sports physician are talking about how to manage this kind of injury. And we believe that, of course, MRI is necessary. And as you can see, this gap in the biceps femoris free tendon, it's probably necessary to have a healing process that not less than 4 months. And what is the best treatment for this kind of injuries? Surgery, biological treatment, conservative treatment. Today, nobody knows because there is not a scientific evidence. But of course, how we are managing this situation? Well, how can we classify and name muscle injury is another challenge for the future that we need finally to put consensus in order to name the same form every muscle injury. As you know, they are different kind of classification. Specifically, when we talk about the hamstring injuries, probably the most famous is the BAMIC, the British Athletic Injury Muscle Classification, or this is the last one that we promote, that is the Football Club Barcelona and Espetar muscle injury classification. They are different classification, different name. And of course, how is possible then the same injury with different names? You may be allowed, but this is kind of details make all difference in professional and high levels athletes. And probably many articles and studies we have seen about MRI and ultrasound are not enough useful for a good diagnosis because don't take these two into account. Well, and then how do we know when an injury is really being overcome and is ready to return to play? That is not easy. And as you know, there are some concepts regarding the return to play in the literature, no? And it's important to see that depending of the localization, depending of many things, you can do the best prognosis. But repeat, it's very difficult to manage each muscle injury. For this reason, Football Club Barcelona promotes his muscle injury guide, where we talk about that how we believe that needs the time for recovery of each kind of muscle injury. And for example, that is, I think that maybe you have seen this muscle injury guide. that is very easy to get online on the Football Club Barcelona web. And for example, you can see in this slide that when you suffer a free tendon injury, you maybe need 4 months in order to have a good healing process. But at least in a myotendinosus injury, maybe you need between 6 or 8 weeks. Or when you have a myofascial injury, maybe with 2 or 3 weeks is enough. It's important to do a good diagnosis with a good ultrasound or MRI. It's important to have an experience in order to know exactly which is the best prognosis. Because as you know, the coach would like to know exactly when he can play again a match. How can we monitor the healing process? That is not easy. We believe that MRI is part of these strategies in order to know how is the healing process. During even sometimes we can do a MRI every 15 days and ultrasound every 1 week. Of course, you need to know and to do some different exercises exploration. You need to do different strength tests, but MRI can help us in order to know how is the development of this scar during the healing process. This is an example of the timeline of the biceps femoris muscle injury that we propose 8 weeks in order to have the best return to play. And as you can see, we do many exercise tests, but also MRI can help us. There are another strategies, and for example, in this return to play consensus from 2017, the doctors believe that maybe the GPS data is the best way in order to know when this player is ready to play again. This is the best way. I think that this is part. Imaging is the best. Imaging can help us. There are many things, different tools that can help us in order to obtain the best way in order to decide that this player is ready to play again. But what else? And that's, please pay attention, but this is new for more of you. You know what means sportomics? Sportomics is the use of omics science with a classical clinical laboratory analysis that to mimic the adaptations of the player to different things, specifically to training and to competition. Well, for this reason, we need to review what means the genome, epigenome, transcriptome, proteome, metabolome. It's not easy, but repeat, in all hospitals, when we talk about the personalized medicine, we are talking about this, because this is the way in order to obtain biomarkers that help us in order to know if the healing process is finished or not. Another message for you, be careful. Men and women are different in terms of genetic. That means that if we have 20,000 genes, 400% is different from women and men. And this is important to take into account. For example, we found that, for example, there is a specific genotype, this genotype of the gene of the actin-3, that allow us in order to identify the players that are more prone to suffer muscle injuries. And the time of the recovery in this kind of players are longer. It's important to know this. This is just only to know if you have specific polymorphism from your genomic. Another thing, how is important to find a new biomarkers that to determine that if you have risk to suffer a tendon rupture. You know that they are maybe the 25% of the tendon rupture are in people that never has any symptom. If you have this kind of biomarker, you can promote different preventive strategies. And what about changes in imaging finding and metabolic profile? Can help us also to the return to play? Well, imaging markers are coming, and probably thanks to the radiomics, we will help to the radiology and, of course, to the sports physician in order to know, for example, in this case of injury, if the tendon have a good evolution or no. Sometimes just only to have a look is not enough, and for this reason, radiomics can help us in this. If this tendon is in the good way in terms of that obtain the best healing. But not also the imaging is enough. We are now using proteomics and metabolomics in order to know how is the moment that these healing processes are in that moment. And for this reason, you need to know a lot about the metabolomics Today, we studied maybe thousands of metabolites. After 3 years studying a lot, we now to identify some metabolites that are determinant for women and others for men. That's first step. And for example, take into account these 56 metabolites that put in the PCA form like this, that you can see in this screen, you can determine, for example, that this player that has suffered an injury, he's out of the normal conditions. In order to be more understand better, this is a typical MRI that, as you can see, a muscle injury of one of our player. Okay, this is a myotendinosus rupture, and in that moment, when we obtain a urine sample, you can identify this sample in this area. This is out of the normal condition, and after 8 weeks, when we believe that maybe he is ready to play again, this image, as you can see, not good scare, and probably the radiologists say, be careful with this because I think that he's not ready to play, but the metabolic profile say that yes. Finally, he played, and the return to play was successful. I think that this combination between imaging and metabolomic is a great new strategy to the criteria of return to play. And what about new treatments? Well, this is a histological longitudinal analysis of muscle injury evolution of one of our studies, and as you can see, the different parts of the healing process, the degeneration, inflammation, regeneration, fibrosis. And we studied a lot in the rat model, in the sheep model, and the human model. And I'm sorry, but PRP doesn't not end any beneficial effect to the exercise based therapy in the treatment of injury skeletal muscle. We don't use PRP in muscle injuries. That is our experience. Maybe it's a good anti-inflammatory, and maybe have an important part just only in the first days, but these don't reduce the healing process. And opposite, we believe that cell therapy is the future. Cell therapy, yes, he has demonstrated that, first of all, after to transplant by intramuscular ultrasound guided injection of the cells in the injury area, after 1 month, these cells are exactly in the localization. And second, it's important to know that these cells, of course, increase the cross-sectional area of the myofibers, and also these cells can degrade the fibrosis. That is true, that is in the rat models. In the human, for example, we know that this kind of cells can do something that is very interesting. Cells are life in all sense. They live, and they can create life. Maybe this is not important in the muscle injury because the muscle injuries are very plastic, but in tendon injuries, be careful. And we demonstrate in humans that we have a lot of experience in autologous expanded bone marrow stem cells in tendon. And if I told you that when the intramuscular tendon injuries are the worst injuries, because maybe cell therapy can help us in this kind of injury in the future. We demonstrate that, of course, the patient will participate that receive bone marrow mesenchymal stem cells demonstrate that produce greater improvement in tendon structure when compared with the patient that receive just only PRP. And for this kind of injuries that I told in the start of my presentation, that we are talking about that deep free tendon hamstring injuries that probably are the worst injury in terms of muscle injury in the football world. Today, it's not clear that it's better to do the conservative treatment or surgical treatment. They are a new probably treatment that is cell therapy. And what about the prevention strategies? And now I am finishing. That is important, but for this reason, we need to monitor our players. But how we can do? I like to explain you very briefly that our experience in the female team, in the football female team of Football Club Barcelona in the last 4 years. We tried and we promote to identify many data from the neurocognitive status, from the genetic susceptibility, from the biomechanics analysis, hormonal formation, omics, external always using the GPS, and imaging biomarker radiomics. With all these big data, we promote to assemble everyone and try to do something that is very interesting for you. That is, can I predict injuries in elite female football players with this GPS and this multi-omics data? Well, in order just only to show you, if you use just only the GPS data, the prediction is very small, 65%. Maybe this is not useful for our coaches, but be careful. When we put in the same equation metabolomic data, the prediction is increasing with genetics more. And maybe, of course, with putting in the same algorithm more data, probably we will finally have a good estimation in terms of to prevent muscle injuries in our player. And finally, and this is the future, we need to use this concept of the digital twin. And we would like to know exactly to have an avatar of all of our players. And for create this avatar and to create a new simulation for the future, we need the big data. Well, and finally, I would like to send you the take-home message. First of all, it's important a correct diagnosis. Second, remember respect the biological timing. Third, multidisciplinary vision is absolutely necessary. Need to obtain to get the true consensus in return to play in a professional football players. Share decision to be very clear with the player. Monitoring external load, for example, with GPS, and internal load with omics and something else. Need to find a new markers, not just only imaging, not just only in terms of omic. New biomarkers are very necessary, and the relationship between the clinical implications. And finally, we need to find efficacy of the new biological treatment, because probably this can help us in order to manage this kind of injuries. Thank you very much. I hope that you enjoy with my presentation. And please, if you have any question, don't hesitate to contact with me. Bye.